We're the generation that had it all. We're the generation that had the music and the moves. We're the generation that had a dream. We came together to feed the world's children. We came together to protect them. And in this dangerous world, we have to keep on saving them and protecting them, even when we're gone. If we remember UNICEF in our will, we'll be the generation who left a better world for children. Please visit uniceflegacy.ca.
Do you have something to share? Let everyone know about your next meeting, your need for volunteers, or your fundraising event on the Rogers TV Community Billboard. Send us your words and we'll bring them to life on Rogers TV and rogerstv.com. When it's time to spread the word, go to rogerstv.com to add your announcement to the Community Billboard.
Welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honourable Blaine Higgs, Premier of New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-parole aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et le Premier ministre, l'Honorable Blaine Higgs. Dr. Russell.
Good afternoon, everyone. Bon après-midi à vous tous. Dans la transition vers leur nouvelle normalité, les citoyens du Nouveau-Brunswick ajustent leur vie de tous les jours pour limiter la propagation du virus responsable de la COVID-19. Les entreprises reprennent leur activité et les gens fréquentent de plus en plus d'amis et de membres de leur famille. À l'approche d'une longue fin de semaine, il était important pour tous de continuer à se protéger et à protéger les autres en respectant les directives de santé publique. Une semaine s'est écoulée depuis l'annonce d'un nouveau cas confirmé de COVID-19 dans la province et je suis heureuse d'annoncer que nous n'avons aucun nouveau cas aujourd'hui. Des 120 cas signalés jusqu'à présent, seuls 2 demeurent actifs. Aucune personne n'est hospitalisée présentement au Nouveau-Brunswick en raison de COVID-19. Il faut cependant continuer à faire preuve de prudence. Businesses are reopening and people are seeing more of their family and friends. With a long weekend coming up, it is important that everyone continue to protect themselves and others by following public health direction. It is now 1 week since we reported a confirmed case of COVID-19 in New Brunswick, and I am pleased to report again today that we have no new cases. Of the 120 cases reported to date, just 2 remain active and no cases are currently hospitalized, but caution is still required. As we continue along the road to recovery, we must do all we can to protect those who are at great risk from this disease. Since we moved to phase orange of the recovery last Friday, I have seen that many New Brunswickers are wearing a community face mask when they are out in public and can't maintain physical distancing. Masks should be worn for a short period of time, and I encourage everyone to do this, but it is important to keep in mind why you are wearing a mask and when and how it is used most effectively. So if you have come into contact with COVID-19, you may not know it. Your symptoms may be very mild, or you may have no symptoms at all. And by wearing a mask, you are preventing any droplets that could carry the virus from you from being passed on to anyone close to you. This is most effective in circumstances where physical distancing is difficult, for instance, in a crowded supermarket, a short appointment, or in public transit. It is required that you wear a face covering in these situations, but you should not wear a mask all the time or even for extended periods. En portant un masque, vous empêchez que les gouttelettes pouvant être porteuses de virus soient transmises à quelqu'un qui se trouve près de vous. Le port de masque est particulièrement efficace dans les endroits où il est difficile de respecter les consignes de distanciation physique, comme à l'épicerie ou lorsque vous utilisez un mode de transport en commun. Vous êtes tenu de porter quelque chose pour vous couvrir le visage dans de telles situations. Vous ne devriez cependant pas porter un masque tout le temps, voire même pour les périodes prolongées. The germs that you are preventing from being launched into the air around you will be trapped in the mask and can be re-inhaled, and that can have unintended consequences. A mask is most effective when worn for a short time when 2 meters of physical distance cannot be maintained. If your job requires you to wear a mask for an extended period, change the masks regularly and make sure they are properly cleaned in hot soapy water. And if the mask becomes wet, that's a signal that you have to change it as well. A mask is a tool to help prevent the spread of infection. It does not replace physical distancing or frequent hand washing, and it doesn't replace not touching your face or staying at home when you feel unwell. So, and again, because if you're touching the mask, you can then contaminate your hands, and that's not a good idea either. So you have to be very cognizant of that when you're wearing a mask. Un masque est un outil qui aide à prévenir la propagation d'une infection. Il ne remplace pas les autres mesures comme respecter les consignes de distanciation physique, se laver fréquemment les mains et ne pas se toucher le visage et demeurer à la maison si l'on ne sent pas bien. These are all part of our new normal until a vaccine or other effective treatment for COVID-19 becomes widely available. Wearing a mask shows that you care about the health of your fellow New Brunswickers. You can also show your concern by looking out for those who are most vulnerable to the effects of this disease. And while COVID-19 can and will infect anyone, there are many in our province who are at a greater risk of medical complications if they contract the disease. As we have seen, the frail, elderly, and those living in nursing homes are particularly susceptible. With those underlying medical conditions such as heart disease, high blood pressure, lung disease, diabetes, and cancer, these people are all at risk. This is true of those with weakened immune systems due to chemotherapy and other forms of medical treatment. And this is true of people at any age. So the homeless are at risk, as are those suffering from substance use disorders, disabled people, and those living in adult residential facilities. Those in corrections facilities, First Nations communities, may all be more vulnerable to the effects of COVID-19. And so it's very, very important that we work together to protect our most vulnerable citizens. We can lend a hand to our older friends and relations by offering to pick up their groceries and supplies so that they can avoid places where they might encounter the virus. And if you do go shopping, again, make sure you're wiping down the groceries and items that you do buy. Many stores now offer specific times for elderly and vulnerable to shop, and you can encourage others to use this service. We are all in this together, and we have to get through it together. And one of my staff said this morning, I said, oh, we have a great team. And she said, we have a team, because I don't know, we were talking about something like 8,000 people in this province who are actually directly working on this. And they said, no, we have a team of about 750,000. And I did agree with her. So all of the entire population of New Brunswick is on our team. Nous devons absolument travailler ensemble pour protéger nos citoyens les plus vulnérables. Nous pouvons venir en aide à nos amis et parents plus âgés en leur offrant d'aller chercher leurs épiceries et autres produits afin qu'ils puissent éviter les endroits où ils pourraient contracter le virus. Et n'oubliez pas de laver et désinfecter les produits et les boîtes et les sacs que vous livrez à la maison. De nombreux magasins réservent maintenant des périodes de temps précises aux personnes âgées et aux personnes vulnérables et vous pouvez encourager les autres à profiter de ce service. Nous sommes tous confrontés à la même situation et nous devons nous entraider pour traverser cette épreuve ensemble. Et un de mes staffs avait dit ce matin, j'avais dit quelque chose comme « Oh, on est une équipe forte, on est une équipe très effective. » Et elle a dit, ben, on a des nombreuses personnes qui sont sur notre équipe. On a 750 000 personnes qui sont sur notre équipe. Alors, c'est vrai, c'est formidable. Tous les citoyens du Nouveau-Brunswick sont sur notre équipe. Alors, we have achieved good results because of your actions. So please continue to do what you are doing. It really does matter. The issue around what you do in your bubble and who you have close contact with really, really matters. So when you go out, make sure it really is for essential things. Make sure you're staying 6 feet away from people. Make sure you are washing your hands frequently. Make sure you're disinfecting surfaces. Again, COVID-19 travels with people. So you are the vector. You are a person who can transmit to somebody else, even if you don't have symptoms. So again, it's really, really important that we follow all of the public health guidelines and measures that are in place right now to protect everyone. Practice physical distancing, wear a community face mask when you're in a crowded place, wash your hands, avoid touching your face, and get outside this weekend. It's going to be a long weekend, and I do encourage people to get outside. Being outside does decrease the risk of transmission. We know that transmission of COVID-19 happens more frequently indoors, so if much time as you can spend outdoors, the better. That's really good for your mental health, and it's really good for your physical health. And you can socialize that way also. So if you have symptoms of COVID-19, even if they seem very mild, please arrange to be tested. 811 is there, your family physician is there, your nurse practitioner is there. Please contact them if you have symptoms and get tested. And if you know somebody who has symptoms, encourage them to get tested as well. These are all very, very important if we want to continue to control the spread of the virus as we release measures and as businesses open up. We can't make COVID-19 go away, but we can learn to live with it and protect ourselves and others from it. Alors, c'est vraiment important que vous continuez à faire toutes les choses qu'on a recommandées jusqu'à maintenant. C'est très, très, très important de protéger les contacts étroits que vous êtes en contact avec et protéger ceux qui sont plus vulnérables. C'est vraiment important. Et cette fin de semaine, je vous encourage de passer du temps dehors. C'est bon pour la santé mentale, c'est bon pour la santé physique, c'est bon pour les relations avec vos amis puis votre famille. Et la transmission du COVID-19 se fait est diminuée à l'extérieur. Alors, c'est pour ça qu'on veut que vous êtes dehors et on veut que vous soyez, vous faites la distanciation physique de 6 pieds ou 2 mètres. So, avec ça, je vous souhaite une bonne journée. Thank you very much. Merci.
Bonjour, good afternoon. First off, I want to recognize that this is National Police Week. I want to offer my thanks to the women and men who work on the front line and support roles in New Brunswick. Those working in policing make many personal sacrifices on behalf of all of us. Nos policiers travaillent de longues heures, selon différentes horaires de travail, et ils font face à diverses situations qui peuvent être très traumatisantes. En tout cela faire partie de leur engagement à assurer notre sécurité. Je sais que tout le monde apprécie le travail accompli tous les jours par les travailleurs de première ligne et les premiers intervenants. One area where we currently have increased police presence is at our borders. This is necessary to help protect the health and safety of all New Brunswickers. At this time, all non-essential travel into our province is prohibited, and peace officers are authorized to turn away anyone if they do not meet the exemptions permitted. The number turned away is small, an average of only 39 a day. Some travel is necessary, and when people have a valid reason to cross our border, we allow them to do so. Par exemple, certains résidents d'autres provinces doivent entrer au Nouveau-Brunswick pour travailler ou pour recevoir des traitements médicaux ou pour des motifs humanitaires exceptionnels, comme pour prendre soin d'un proche qui est aux soins palliatifs. Les déplacements nécessaires comprennent également les déplacements qui sont nécessaires pour permettre aux enfants de passer du temps avec leurs parents. New Brunswick residents who have been out of province temporarily continue to be permitted to return home. While we are committed to keeping our borders secure, essential travel is still permitted, as goods needs to get through, not just to our province, but to Prince Edward Island, Nova Scotia, and Newfoundland and Labrador. However, to ensure the health of New Brunswick residents and lower the risk of infection of COVID-19, we will continue to stop unnecessary travel into our province. While we have loosened some restrictions with our move into phase 2, the orange phase, and are taking steps to reopen our province, we recognize our vulnerability to COVID-19 is heightened through this process. Eventually, we will be in a position to loosen our border restrictions, but we are not there yet. Demain, nous allons renouveler l'état d'urgence pour refléter notre situation actuelle. Et nous allons continuer de le faire toutes les 2 semaines, tant aussi longtemps que cela sera nécessaire pour protéger la santé et la sécurité des gens de New Brunswick. Since moving to Orange, early data is showing that some businesses have been able to resume operations. A survey conducted by the Canadian Federation of Independent Business a few days before May 8th showed that only 21% of small businesses in New Brunswick were fully open. Just a few days after we announced on May 8th that we were moving into phase 2, another CFIB survey showed that the number had increased to 26%. We know this trend will continue and are grateful businesses have taken this seriously and ensuring that they do it right. We want to help New Brunswick businesses reopen, and we want to put New Brunswickers back to work. Yesterday, the federal government announced a new temporary policy that will drastically reduce the time it takes for temporary foreign workers already in New Brunswick to start a new job. This is good news for the temporary foreign workers currently in the province who are looking for work, and is good news for New Brunswick industries looking for workers. Even with this welcome announcement, the worker shortage still exists. We need New Brunswickers to step up for our province and for the industries that have jobs available, especially seafood processing and agriculture. Pour aider à jumeler les gens qui cherchent un emploi et les postes qui sont disponibles, nous avons organisé cette semaine, un salon d'emploi virtuel de 2 jours. Nous n'avons encore pas le dernier chiffre, car le salon d'emploi se termine aujourd'hui. Mais j'ai quelques résultats. As of this morning, 1,833 job seekers attended the virtual job fair. 51 employer booths were set up, representing many industries and from all regions of our province. The virtual job fair had 2 specialized areas, including a resource area for job seekers and Job Match NB. If you're looking for a job, I encourage you to visit the Job Match NB website. New Brunswick needs you. This is your opportunity to step up to help build a stronger New Brunswick. We must continue to work together to support New Brunswick businesses and industries, to take care of one another, and to contain the spread of COVID-19. Thank you. Merci.
Merci, Monsieur le Premier Ministre et Dr. Russell. Thank you, Premier and Dr. Russell. We'll now proceed with questions from the media. You have the right to pose the question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Elizabeth Fraser, CBC.
Hello, my question is for the Premier. This morning, the Public Safety Minister told CBC News that international students are allowed to enter the province because they're in a different category than, say, temporary foreign workers. Can you confirm this and can you clarify the distinction between the two groups? And also, we heard Dominic Hardy say yesterday that New Brunswick could be closing its borders for the entire summer. What can you say about that?
Well, I think what I can say about any of that is that in relation to the phases that we're implementing and have implemented over the past month, is that conditions remaining the same would allow us to continue to open up our province. And that very thing stands true with certainly access through borders or access from other provinces in the country. It depends greatly on their situation around us. So to make any precise timeline on when something might open or not is based on our activity in relation to the pandemic and our success continuing. In relation to foreign students, I think what we're looking at is looking at the ability for our universities to plan for the coming year. Now, while conditions will again be the overriding factor in ultimately allowing citizens or students to enter our province, we're optimistic that coming into the new year, we'll be able to resume activities in post-secondary education and allowing the right protocol to ensure that students are able to not only like where they're coming from, are they coming from a safe, healthy environment, and are they able to meet the standards of public health to be here. But it's too really early to put a prescriptive time or a prescriptive number or a prescriptive opening of a particular activity in that regard.
Thank you, Premier. Ms. Fraser, do you have a quick follow-up today?
Yes, I do, for Dr. Russell. We've heard from daycare operators and parents who question the plan to allow groups of up to 15 children with no physical distancing when the rest of the province is restricted to 2 household bubbles. They question why it's not safe for them to spend time with their extended family members, for example, when they know and trust what precautions they can take. But it's okay for their children to be exposed to families and bubbles of other children at the daycare. What do you say to them?
So I understand their concerns around that issue, and basically for the daycares that are already running, obviously providing service to essential workers to be able to operate our healthcare system, et cetera, has been critical. So, and also looking at the economy and what needs to happen for people to be able to work and have that childcare. So we have a 16-page document that we provided to EECD with the help of several of my staff that have provided input for that, and it's very clear guidance. And obviously keeping the risk as low as possible while doing the things that we need to do to operate as a society is really important. So I can understand those concerns, but as we've been moving through the different phases, we try to make decisions that are evidence-based and balance the risk with what the necessities are in terms of what we need to function as a society. So I do understand that, and it is challenging, but this is, again, the things that are in place right now to help with the childcare guidance and direction. Again, my understanding is there's going to be a technical briefing on that tomorrow, so more information can be provided then. But certainly, again, the daycares that have been already operating have guidance, and then the licensed ones with the province are going to be spoken to tomorrow with the technical briefing, and again, the guidance document that we provided for EECD.
Thank you, Ms. Fraser. Thank you, Dr. Russell. David Coach, Times and Transcript.
Hi, yes, questions for the Premier. Recently, the Conservation Council issued an open letter to your office outlining a number of proposals for a green economic recovery plan, saying that, and members of the group have said that this would basically, involve economic stimulus, putting people to work while at the same time making the environment, making New Brunswick more sustainable, particularly in terms of averting hazardous climate change. I was wondering if you're considering the proposals put forward in that letter.
I can't speak to the contents of that letter at this point. I have not reviewed it myself, but yes, we certainly would consider the contents of the letter to understand, how we might be using not only our federal funding initiatives that would be available, but also how we may use the carbon tax, because it may apply in that regard as well. But, it would be something we could review with our team, our COVID Cabinet Committee, and something we could look forward to, I guess, in many aspects. Because we are looking at any method, any and all methods of recovery, economic recovery in our province.
Thank you, Premier. Do you have a follow-up today, Mr. Cope?
Also, just there was an article from the Canadian Press with Mr. McKenna, Minister of Infrastructure, indicating that more than $3 billion of the Invest in Canada infrastructure plan is being fast-tracked and would increase Ottawa's share of spending to 80%. Normally, Ottawa will cover one half of political projects, according to this article. Just wondering if you're looking at this funding and in terms of green projects in particular.
Yes, we are indeed, and the request we made of the federal government is to have more flexibility into the projects that the fund can actually be used for. We are looking at areas where we can maintain current infrastructure or to upgrade current infrastructure, and that could apply to hospitals or schools or roads or bridges or any particular facilities that we need to have improvements or maintenance improvements. There's restrictions currently in the use of those funds, and I guess the relevance of asking for that sort of flexibility is I'm trying to defer future expenses that are coming that we know of because of the condition of some of our assets, and the more that I can do to defer those future costs, or not defer them, but actually do them now with this funding rather than do something else that's not needed, it's going to help us recover quicker as an economy. It's going to continue to provide the work that is what this is all about, to get people back to work, but it'll allow us to be in a better financial position in the coming years.
Thank you, Premier. Thank you, Mr. Coates. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier. Premier Higgs, we've heard that jury trials will begin opening up in some jurisdictions soon. In what capacity will courts be resuming in the near future?
What was the last one? What capacity? What? I just didn't hear.
Can you repeat that, Ms. Hogarth?
In what capacity will courts be resuming in the near future?
So as I would understand that they're setting up the same way as any other requirements for public health in order to function. And I think there's a lot of activity being done in virtual capacity in the courtrooms and in some of the hearings, which is I don't understand all the details of that, but I think there's some innovative ways being put forward in how we can manage courtrooms and at the same time expedite the hearing. So because many things take months and years, And I think there's a lot of good work being done right now throughout that system, working with court officials and the Office of the Attorney General to ensure that we can kind of pick up, maybe to get back on track for the lost time, but also in the future to have a better performing system.
Thank you, Premier. Ms. Hogarth, do you have a quick follow-up today?
Just a quick follow-up for the Premier. Premier Higgs, as businesses reopen, is the province considering doing any random check-ins on businesses to ensure protocols being followed? In what ways will there be additional measures for monitoring for safety protocols?
Yes, indeed. So there's one in the sense of voluntary, people would ask us to come and inspect it, and that would be through WorkSafe primarily. To look at the facility and maybe get a second opinion on the way they're operating. But the other is that we will certainly be following up. WorkSafe will be doing inspections. Our compliance officers will be doing inspections randomly at this stage to just ensure that that the system is being followed. But as I've said in previous press conferences, the goal here is not to catch somebody. The goal is for everyone to do what makes sense, common sense, to protect each other. And so no one should feel like they're getting away with a fine or they're avoiding a speeding ticket if someone doesn't catch them. But they should feel guilty if someone catches the COVID because they're not doing their part to protect themselves and others.
Thank you, Premier. Thank you, Ms. Hogarth. Laura Brown, CTV.
Hi, Premier. I've been hearing from some businesses that they still don't have specifics on what they are required to do in order to reopen. They have seen loose information like physical distancing, wearing masks, hand washing, cleaning services, but they're looking for more specifics. One business told me that he was told that he should have an isolation room. I'm just wondering, do you feel like the government, our government departments, I guess, are behind in trying to give businesses as much information as they can, just because of how many industries and sectors that need specifics there really are?
Laura, it's a very good question, and we do have documents. We have worked with WorkSafe, Public Health to provide information on the website. There's also a business navigator that people are directed to get more information from, and we can be more specific when we answer those questions in that context. And then also so those are two areas that we're encouraging people to use when they have those kind of detailed questions. But it is really about each organization putting together their plan. We did have engagement sessions all last week with different sectors of business. We did meet with the Chamber of Commerce. So there has been quite a bit of engagement with those organizations, and the information that I have specifically around isolation rooms is that they're recommended but not required. So again, there's many avenues to have some of these questions addressed. As I mentioned, there is information on the website through WorkSafe and Public Health. And obviously, again, the engagement sessions that took place last week, and then the Navigator phone number that you can talk to people. They have that staffed up to be able to address specific questions. And again, the isolation room is around people who show symptoms. So obviously, if you're encouraging people to not come to your establishment if they have symptoms, then that's the best way to avoid that, including staff members. And I have heard anecdotally around people who have been in work environments that they didn't feel safe in. So I think employees and employers really have to have a good understanding of what everybody needs to feel safe, and certainly having that open communication is really, really important, and having a way to get answers to their questions is really important, and having that information on our website and the Navigator is key.
Thank you, Doctor. Ms. Brown, do you have a follow-up?
Yes, thank you for that. I'm wondering if the government is sending out its inspectors now to see if businesses are adhering to the rules they have to adhere to, and if they have operational plans in place.
So we will actually send out people to work with a particular business. So if there's a request to come and visit the site, then WorkSafe will visit the site, or our compliance officers will visit the site. So we will do that on a request, and we'll do it as well randomly.
Thank you, Premier. Thank you, Ms. Brown. Matthew Roy-Comont, l'Acadie Nouvelle.
Bonjour, ma question est pour le Premier ministre Higgs. J'ai discuté aujourd'hui avec le député fédéral d'Acadieux-Bathurst, Serge Cormier, qui était très surpris par vos propos de lundi sur le financement fédéral des infrastructures et le besoin pour plus de flexibilité. Le député Cormier me disait qu'il y a déjà énormément de flexibilité dans tout ça et que le Nouveau-Brunswick, que votre gouvernement était celui qui laissait le plus d'argent sur la table et qui proposait le moins de projets d'infrastructures avec l'aide du fédéral. Quel est, et pour des choses utiles comme entre les eaux et les égouts, qu'est-ce que vous répondez à ce commentaire-là?
Well, I would gladly go through the details of that with Mr. Cormier to review the specifics of what we're asking for versus what we're currently receiving. The flexibility that was granted was about 10% of the value of the fund, and it was about $67 million that we would have ability to use towards projects that we considered as important to New Brunswick. So while we're grateful to the federal infrastructure funding, we want to focus on projects that are kind of paramount to what we see as needed for the province to maintain and operate our facilities that we currently exist. So I would just ask that, I'd review those details at any time, and maybe he could help us get a broader range of flexibility.
Merci, M. le Premier ministre. M. Roy-Como, as-tu un suivi?
Oui, merci à nouveau pour M. le Premier ministre Higgs. Selon l'analyse de la Banque Scotia, le Nouveau-Brunswick est de loin la province canadienne ayant mis en œuvre le moins de mesures d'appui fiscal depuis le début de la pandémie. Avez-vous l'intention, comme d'autres provinces l'ont fait, d'annoncer des projets d'infrastructure pour stimuler l'économie au Nouveau-Brunswick?
So the process we're taking here, and again, is to not throw money at the wall and just hope something improves the outcome, but actually to understand what can we do on projects, and as I say, to provide the maximum benefit to our province in relation to providing work, bringing the economy up, helping businesses get secured, helping the system grow. Looking at, I had a meeting yesterday with a northern group of companies, and very, very informative about areas that they looked at for long-term view. So the basic philosophy is this. Any money I put towards any effort now is coming out of the pocket of New Brunswickers, or it's a federal program that is coming out of the pocket of Canadians. So I'm trying to get the best value I can going forward, because whatever I spend today is something that somebody's got to deal with tomorrow or next day or next year or 5 years from now. So I've asked many people, whether it be municipalities, whether it be companies or businesses, what do you want New Brunswick to look like next year or the year after or 5 years down the road? I've said, I'm very concerned what it'll look like federally, because will our transfers be impacted because of the position that the country is going to be in, and the position that some of the major contributors to our transfer payments, provinces like Alberta, are in such difficult times right now. So I'm looking at everything for the longevity of our province and for the sustainability of companies. I'm not looking for a short-term fix. I'm looking for long-term solutions, and we'll put the money where we need to put it in order to ensure we have a long-term vision in how we rebuild our province.
Thank you, Premier. Merci, M. Roy-Como. Silas Brown, Global TV.
Hi, Premier. I've heard from daycare operators that are saying that they just are not going to be ready to open on May 19th and are going to have to push until June 1st until they can open. That will make it almost a month since businesses were allowed to open, and when some childcare centers will be opening, potentially leaving some people without childcare over the next couple of weeks. Looking back in hindsight, would it have made sense to maybe put those two dates together? And are you concerned that some people who need it aren't going to be able to find childcare when they need it over the next couple of weeks?
Well, sure, it's a concern, without question. However, we've had tremendous response from the daycare operators in terms of their interest to get back up and running. I think like a 92% of the daycare operators said, we're ready, we want to get up and running. And I say ready is we want to get ready to move. So I don't know how many are in the group you're saying won't be ready by May 19th, and I guess we would be interested to know that, because businesses or people coming back to work are going to be able to need to have alternate daycare requirements met. And but I don't know that that's a large number. Right now, we recognize it's important. We need to have those facilities, and we will work with local communities as we find that's an issue. I do believe that there's further information being provided tomorrow in that regard, because the Minister of Education, Minister Cardy, has been looking into that very thing. So we'll see what the results of that effort is tomorrow.
Thank you, Premier. Mr. Brown, do you have a follow-up?
Yeah, just quickly, another one of the things that I've been hearing from operators is that the amount of children that will be coming back is a lot less than what they closed with. And some are really worried about what sort of a financial impact that's going to have when things like overheads and staffing levels are really going to remain the same and even potentially grow as they try to the new requirements. How concerned are you by that? Would the province consider stepping in with any additional subsidies to help ensure that daycares stay open for people who need childcare?
I think, as previously noted, many of those issues will be discussed tomorrow when Minister Cardy addresses the daycare situation. Looking at also the timing of which daycares can gradually maybe get back to their normal capacity, again, depends on the success we have over the coming weeks. So as of, let's say, the 19th, we'll be getting into the 2 weeks of opening up, and I guess we'll see where that goes and work with public health to see what the next steps might be.
Thank you, Premier. Thank you, Mr. Brown. Michel Corriveau, Radio-Canada.
Bonjour, merci Bruce. Une question pour le Premier ministre, M. Higgs. J'aimerais savoir, M. Higgs, est-ce que ça serait envisageable pour le Nouveau-Brunswick d'ouvrir une sorte de corridor ou un laissez-passer pour les Québécois qui veulent se rendre aux îles de la Madeleine, les îles de la Madeleine qui font partie du Québec, mais il faut passer par le Nouveau-Brunswick et l'île du Prince-Édouard pour s'y rendre. Donc, qu'est-ce que vous en pensez?
Well, I think it's another one of those issues we look at, working with public health and how we can allow safe transit through our provinces to other provinces. We already do it coming from, from other provinces through New Brunswick to Maine or to Nova Scotia to PEI or to Newfoundland. So, I mean, the same courtesy, would make sense to be provided here. So I would be willing to look at this and how that would be transit safely and through our province to get to Quebec. It seems a reasonable request, and we'll work with public health to work out a process that should be workable there.
Merci, Monsieur le Premier ministre. Monsieur Corriveau, as-tu un suivi cet après-midi?
Oui, sur le même sujet, toujours pour aller vers les îles de la Madeleine, Monsieur le Premier ministre. Et là, ici, on parle pas nécessairement des résidents qui vivent sur les îles de la Madeleine, mais d'autres Québécois qui voudraient aller sur les îles de la Madeleine. Donc, vous n'êtes pas fermé à cette idée-là, que je dois comprendre?
Well, when we look at any travel, at this point in time, you look at the necessity of the travel. So the same logic would apply. What's the necessity of the travel? As Dr. Russell said, and as I've been saying as well, borders are our main security for health protection at this stage. And so is there a need to travel would be the question that would be asked. Is this essential travel? Are there humanitarian reasons for travel? What are the requirements? Because otherwise it turns into vacation travel, and at that point it becomes maybe a new philosophy of how we reopen New Brunswick and when. And that very much has to be a coordinated effort with public health to determine the timing.
Merci, Monsieur le Premier ministre. Merci, Monsieur Corriveau. Adil Ibrahim, CBC.
Thank you. This is a question for Dr. Russell. What do you think of the health authorities' pace of reopening and restarting services since we've gone into the orange phase, especially considering the 15,000 patient backlog?
So the decisions around how fast to open and operationalizing all of that, I mean, the RHAs, the Vitalite and Horizon have worked very, very closely with the Department of Health on all of those processes from the beginning when the risks were higher in terms of our worries about having a need for more hospital beds and ICU beds, et cetera. And all of that work was done so quickly at that end in terms of really being efficient and effective. To be able to provide surge capacity if we did have a big rise in number of cases. So in the other direction, as we open things up, we have to do it in a safe and efficient manner. We're doing it with the best evidence that we have available around all of that. And knowing that, again, the price of having emptied the hospitals and having stopped the elective surgeries was quite high in terms of people who needed elective surgery and had to have those things postponed. So whenever we're looking at public health measures and the guidance that we're providing, we take those things into account. We take them very seriously. So obviously moving in the direction of opening things up also involved a lot of discussions and planning, and the operationalization of those discussions is now underway. So I think that things, again, from the beginning of this pandemic, we've worked very, very closely with Vitalite and Horizon and have really appreciated their cooperation and concerted efforts to be aligned and move forward together.
Thank you, Doctor. Ms. Ibrahim, do you have a follow-up today?
Yes, thank you. For Premier Higgs, we understand the government will no longer cover the daycare fees for anyone who's lost their job as of the end of the month. Can you confirm and comment on this, please?
Well, I think it will go into the program and in the discussion tomorrow with Minister Carty. But there certainly was a time limit there on that, and if it goes with the, as I would understand it, it goes with the normal protocol of if you want a daycare space, and there has to be a way to maintain and secure that, and that's the normal process. So as we move back into the new norm, I mean, that some of these things return.
Thank you, Premier. Thank you, Ms. Ibrahim. Adam Harris, Telegraph Journal.
Hi there. Premier, you referenced the federal plan allowing temporary foreign workers already in the country to switch jobs quicker than ever. It appears that your plan to move what you said were 1,600 temporary foreign workers already in the province to different jobs. Could you provide an update on how many of those workers are already in New Brunswick or or have moved to a new job?
So we got the list. I was very impressed. Deputy Minister Freeland has been Deputy Prime Minister Freeland has been very responsive to work with us to get permission, and the minister provided that yesterday to allow us to have temporary foreign workers that were in the province to move from company to company at this time. So we have been given a list of the companies that have temporary foreign workers assigned to them, and we are contacting those companies today to determine if they are currently employed, if they're being used in other activities or with that particular employer, or if they're available. So we received the permission last night. We received the list of companies that actually have temporary foreign workers here in New Brunswick or are signed, and we are connecting with them today.
Thank you, Premier. Thank you, Mr. Harris. Do you have a follow-up today, sir?
Yes, please, Bruce. Premier, Friday is the beginning of the lobster season, and the day that temporary foreign workers were to have finished self-isolating in New Brunswick. Have you filled all the jobs in the fish plants available, or do you know how many remain?
So at this stage, we've learned from the processors that, the intent, many of them are fully staffed or nearly so. Particularly in different, it depends where you are in the province, but also that they're not necessarily all going to start up at full capacity in any event. There's been some, as I understand, some arrangements made with the fishermen in terms of the processing capacity and how much they actually want to process at this time, because the market is soft, very soft. The storage areas are full, and the fishermen don't want to get caught with lobsters that are losing their value when they bring them ashore. And the processors don't want to get caught at paying more than they can to sell their market. So there's a balancing act right now, and there's a question just how much market there's going to be. So I don't know the precise numbers in relation to how many are short. I do know that when you mentioned that they would have been isolated by now for this coming Friday, that was 175. And we've identified at this point, I think in the virtual job fair, there were something like 1,500 people that were seeking employment. And there's been, aside from that, yesterday I reported like 537 that were seeking employment in the province. So we're in the process of matching that rate up now, but it would be my understanding that fish plants can certainly start up and the capacities will be varying in any case. It's also interesting that since we've been in this situation, the numbers of requests have gone up dramatically from where they originally were a week ago. I'm not sure what that entails. Now, maybe businesses are opening up faster than they originally thought, and which is a good thing. Just means we'll work harder to fill those spots.
Thank you, Premier. Thank you, Mr. Hears. Rose Saint-Pierre, Radio-Canada.
Oui, bonjour. Ma question est pour le Premier ministre. Monsieur Higgs, il y a des familles en ce moment qui sont séparées d'une province à l'autre et à cause des contrôles à l'entrée à la frontière, il y a des gens qui ne peuvent pas rendre visite à leurs proches. Est-ce que ce serait possible pour un résident de l'extérieur du Nouveau-Brunswick de rentrer dans la province pour visiter un proche et de demeurer dans sa résidence sans jamais sortir pour 14 jours?
Alors, la question, c'est au sujet des familles qui veulent visiter hors de la province.
Oui, est-ce qu'une personne à l'extérieur de la province pourrait visiter un proche au Nouveau-Brunswick, rester dans cette résidence-là, s'isoler et repartir après 14 jours?
Alors maintenant, la manière que les directives sont au sujet des frontières, c'est on n'encourage pas les gens de voyager, sauf que pour des choses vraiment nécessaires ou pour l'emploi. Alors, les visites sociales, c'est pas vraiment permis à ce moment-ci, sauf que si vous rendez pour voir un proche qui est à la fin de leur vie. Alors, pour cette phase ici, la manière qu'on gère les frontières, c'est de vraiment seulement permettre les gens qui voyagent pour des raisons absolument nécessaires, comme le travail ou quelque chose d'essentiel.
Merci, docteur. Madame Saint-Pierre, as-tu un suivi?
Oui, je pense que mon suivi serait pour M. Higgs, justement pour les Néo-Brunswickois qui rentrent dans la province après un voyage. Est-ce qu'on s'assure de quelque manière que ce soit qu'ils respectent leur auto-isolement? Est-ce qu'il y a, par exemple, des patrouilleurs devant la résidence où ils s'isolent?
Yes, part of the protocol on crossing the border and coming into New Brunswick, if there's a valid reason to come here, maybe they're moving back here or other particular reason, all the particulars are taken and understood, the contact information, and then they're followed up to check on them to see that they're actually following the protocol.
Merci, Madame Saint-Pierre. Merci, Monsieur le Premier Ministre. Andrew Watt, Telegraph Journal.
Hi. Premier, going back to the infrastructure funding, so I spoke to the federal government and they suggested that the flexibility you're seeking will be there. And I spoke to Mr. Vickers and he said the same thing and encouraged you to negotiate in good faith. I'd just like to get your reaction to that, please.
Well, maybe tonight in the meeting I'll ask for clarification on exactly what he meant by that comment. But actually, I would, Mr. Vickers and I could go on a call jointly with the federal government and discuss the flexibility we need in order to look at projects that make sense for New Brunswick. I have been impressed, as I commented about the permission for the temporary farm workers, the responsiveness that I've had, particularly as I mentioned from Deputy Prime Minister Freeland's office, in dealing directly. I mean, I feel like I can call her at any time, and I did that yesterday, and we had a response from her office within an hour. And she actually called my home the other night to check if everything was okay. So it's been very impressive. And so in this scenario, for us to have a clear understanding of what we're asking for and what's been provided, in fact, I think, we'll make sure, I have talked about it in our COVID cabinet meetings, but I will put it on the agenda tonight to make sure it's there so it's clear what we're asking for, the flexibility we need, and I would welcome, assistance from Mr. Vickers to get the right flexibility for our province.
Thank you, Premier. Mr. Waugh, do you have a follow-up today?
I do, thanks. The Bank of Nova Scotia has recently put out a national projection on what COVID-19 has done to the economy, both federally and provincially. It painted a pretty grim picture for New Brunswick, record deficits, that kind of stuff. Have you seen the report? And if so, what do you think?
Well, I haven't read their report particularly, but I did see their projected was that where they were talking that we would have a deficit of over $1 billion or something like that. That's a report, yeah. And I, while I certainly didn't, I haven't seen the details. We will be putting out our quarterly report in a couple months. We are analyzing closely our revenue and our cost structure. And that's why, I talk about what do we want New Brunswick to look like when it's done with the virus, and we don't know how long that's going to be, because we can't count on the revenue stream being there like it was. And when we have a province that's 30% dependent on transfer payments, that is $1 billion there if we lost 30% of that. So it's a $3 billion contribution today in total on a $9.5, $10 billion budget. So if you think of that and you say, okay, let's work with companies, let's work with individuals. That's when I talk about the stepping up for New Brunswick, because I don't want to have a New Brunswick that is in trouble a year from now. I want to have a New Brunswick that's on the rebound and in a way that we never believed possible. And I believe it is possible to do just that. But it doesn't mean that we can just throw caution to the wind. What it means is that every expenditure we put out there has a defined, planned consequence that's positive, ultimately, for the long haul.
Thank you, Premier. Thank you, Mr. Waugh. Savannah Adi, Telegraph Journal.
Hi, Dr. Russell. As I'm sure you know, Health Canada approved the first COVID-19 serology test for youth yesterday. Can you walk me through how and when, I guess, you plan to administer that test in New Brunswick? And at this point, how the results would be used in your decision-making on restrictions?
So there was a task force at the national level that was announced April 23rd. So there's an immunity task force at the national level, and Dr. Theresa Tam, the Chief Public Health Officer of the country, is part of that. And the purpose of that task force was to look at all of the issues around immunity, the serology testing, and also what types of things it would be used for. So looking at giving a picture of what our immunity looks like across the country, what our vulnerabilities are, and how that information can direct policies at this point in time. So what we know now, based on the announcement yesterday, is that the federal government, Health Canada, has approved a specific type of serology testing. And what it means in our province is that the immunity task force will be working in collaboration with the PTs on strategies moving forward. But the good news is in our province is we actually have the capacity in our province. We have the right type of lab equipment at the Georges Dumont Hospital. And so right now internally we're having discussions around what that means, but we will be working in conjunction with the immunity task force around what steps to take moving forward.
Thank you, Doctor. Do you have a follow-up today?
Yeah. So in terms of the immunity, and I guess being linked with, or I guess our understanding of whether the presence of antibodies indicates immunity, could you just summarize, I guess, how far you think we are at this point from understanding whether that presence might indicate immunity, or what we're seeing in other jurisdictions around that?
So I think as we move forward, the science and the research that's been done around serology testing, so that's a blood test that will check to see if you have come into contact with COVID-19 and you recovered from it. There's still a lot of scientific information that we need to support what that means. So if somebody does get the blood test and it does show that they have immunity, we can't really say how strong that immunity is, how long that immunity will last, what type of mutations could be happening in the COVID-19 strain of the virus that's circulating right now. And those things are very difficult to predict at this time. So I know in other jurisdictions, in other countries, rather, they have looked at testing the immunity of the population, and certain individuals then would be given an immunity passport. I don't see that being possible here in Canada in the short term or the medium term, only because it's still not known, again, how long that immunity would last. So for research purposes and for surveillance purposes and getting an idea of how many people in the country have been exposed to COVID-19, I think those are really good pieces of information to use moving forward to inform policy. But in terms of individuals' immunity, I don't think we can predict a lot of things around that in the short term, and it would probably give people a false sense of security not knowing how long that immunity lasts, and it would affect their behaviors. So I think we have to be very, very cautious, and again, I think that's why it's really important that the task force at the national level on immunity exists to inform our strategies and next steps moving forward.
Thank you, Doctor. Thank you, Ms. Adi. Wildernet Paul, Radio-Canada.
Oui, bonjour. Merci beaucoup, Bruce. Alors, ma question, je crois que c'est pour le Premier ministre Higgs. Ça concerne les travailleurs qualifiés et sélectionnés par le Nouveau-Brunswick qui ont déjà reçu leur visa de résidence permanent et qui devaient immigrer cet été, par exemple, dans la province. Est-ce qu'ils auront le droit d'entrer au Nouveau-Brunswick ou l'accès leur sera interdit?
So if I understood that correctly, it was workers that are already here in New Brunswick and they're qualified to go to work, and would they be allowed to do so? In which case the answer would be yes.
Non, ce sont vraiment pour les travailleurs qui doivent entrer. They are not here already. They are supposed to come this year, this summer, for example. Alors, ce sont vraiment les travailleurs qui ont été sélectionnés par le Nouveau-Brunswick.
Well, we've already been through that in the case of workers that were temporary foreign workers that were selected to work here, to come here, and so we've been looking to replace those workers that crew were currently canceled. How do we replace them with workers that are already here? How to replace those with qualified workers that are already in New Brunswick? And that's what we've been going through as of late. Now, I guess as time goes on, we'll continue to look at other qualified workers that want to come to New Brunswick and work with public health in relation to how that might happen. But at this stage, we're working through the requirements of employers to meet those needs through workers we have already here.
Merci, Monsieur le Premier ministre. Madame Paul, as-tu un suivi cet après-midi?
Sur la même question, je crois que ça n'a pas été compris. Je parle des résidents permanents qui ont été choisis, qui ont déjà un visa. Des travailleurs qui devaient rentrer dans la province, qui ont été sélectionnés, pas des travailleurs temporaires. Là.
Yeah, okay, fair enough. Yes, indeed. If someone is moving here to New Brunswick, we would certainly be looking at allowing them here to do the isolation, the 14-day isolation, but they're going to become permanent residents. So that's right. That in the case is like someone immigrating to a province, or it could be someone from across the country or wherever. But yes, indeed, we would look to bring them here, to have them follow the public health rules, and to become a permanent resident.
Merci, Monsieur le Premier ministre. Merci, Madame Paul. That concludes today's update. Thank you. Voilà la fin de notre mise à jour. Merci beaucoup.
Length of the preceding program, we now join the regularly scheduled program already in progress.
So it's for the tourist clientele. So it sees like what the relationship between like the businesses in the region and the inclusion. So they pay for this service because they all contributed to this. So we pick them up. So then we can continue with the program in which we help like people who need transportation for their medical appointments or social activities, just to give you an idea. So in the Chaleur region over the last year, 5,600 trips that were done for medical appointments, to do your grocery, go to the bank, or job-related activities, and it's all managed by volunteers.